Hi guys, hope everyone is keeping safe. So today we're going to be talking about operative dentistry as well as amalgam. So I just wanted to give a shout out to Dr. Zande for helping me out with the slides and allowing me to use his. I'm just going to have my laser on. So I just wanted to cover some basics of foundation in BB Op before we get started so that we're all on the same page. So, what's an operative dentistry? I'm sure everybody knows about it, but just to reiterate, it's obviously an aspect of dentistry, but it focuses on prevention and treatment of defects of enamel and dentin of each tooth. Um, the future of dentistry and the current state of dentistry is more on prevention than on treatment and diagnosis. So we should really know that. As well as it focuses on defects such as caries, which we all know about, attrition, abrasion, and erosion